All right, welcome everybody to the Wake Forest Regional Session for the ACPMP Survivorship Symposium. My name is Karolyn Lewandowski, and I'm the COO and General Counsel for the ACPMP Research Foundation. While I wish we could all be together in person today, I'm so happy to see so many of you here to learn about the latest research into appendix cancer and PMP, and to talk about some strategies for improving the quality of life for our patients. We're going to focus on that for the next hour, starting with Cheryl Sizer, who is a physician's assistant with the Wake Forest HIPEC team. And she's going to tell us a little bit about the HIPEC program here at Wake Forest. So I'll turn it over to Cheryl.
Welcome to the regional portion of our symposium. We're so happy to represent the Southeast United States. And this afternoon, we want to share some helpful information for patients regarding nutrition and finance and how COVID is affecting our patients, and offer you the opportunity to ask specific questions. I'm Cheryl Sizer. I'm one of the physician assistants here at Atrium Health Wake Forest Baptist in the Surgical Oncology Clinic at the Comprehensive Cancer Center. We have the privilege of serving those with various forms of appendix cancer. And our goal, of course, is to provide excellent medical care, but also develop long-lasting relationships with our patients and our families. This year, we celebrate the 30th anniversary of our HIPEC program. Our highly skilled surgeons have performed over 1,700 of these complex surgeries with very successful outcomes, serving patients from all over the country. The center's designation by the National Cancer Institute as a comprehensive cancer center is one of the few in the nation to hold this distinction since 1990. With that, we meet the highest standards for cancer research and patient care, improving long-term survival rates due in part to early access to clinical trials, education, and outstanding outreach programs. Additionally, we obviously have the benefit of serving alongside other institutions, as you've witnessed today, providing the most up-to-date knowledge-based medicine and research. Our multidisciplinary approach to care includes not only our surgeons, but also radiation and medical oncologists, genetic counselors, radiologists, nurse navigators, pathologists, researchers, psychologists. Our entire clinical staff is committed to providing the most excellent individualized treatment plan, as well as a range of support programs for family members. Our sponsor today, the ACPMP Research Foundation, has a wonderful website and Facebook page that I encourage you to take a look at. Also, there's going to be several helpful hints that you can check out after the symposium. At Atrium Health Wake Forest Baptist, we embrace a holistic approach to healthcare, specifically leaning towards quality of life. And with that, I'd like to introduce Monica Moorefield. She is one of our registered dietitians, and she specializes in the nutritional needs of complex surgical patients. Thank you for joining us today, and thank you for allowing us to be part of your healthcare, your healing, and survivorship.
Okay. So I'm going to talk about pre-surgery, post-surgery, and let me get this up real quick, and some symptom management. So before surgery, it's good to maintain, or if you're underweight, to gain weight. And the best food choices are, a variety of fruits and vegetables. Different colors are good to get different antioxidants and phytonutrients. And then also to get plenty of good proteins. Fatty fish twice a week is very healthy, such as salmon, tuna, mackerel, sardines. Low-fat dairy and legumes such as beans and lentils, eggs and whole grains are all good. So a good, healthy, balanced diet with variety. And then you want to avoid processed meats as much as possible. Limit red meats to 18 ounces a week. And to give you a little reference, 3 ounces is the size of a deck of cards, to help understand what 18 ounces means. And then limiting refined grain products. So like the white flour, white bread, white crackers, white toast, things like that. Added sugars, you want to also limit. And then in some cases, supplement drinks may be helpful if you're not able to eat very well, like Ensure or Boost. Premier Protein, I know, is a very popular supplement as well. And for post-surgery, you may have diet restrictions. It's just going to depend on the surgery that's done. So that's individualized. But the goal right now is going to be starting soon. The after surgery diets will be advancing sooner. So if you have a bowel resection, the goal is for day 3 after surgery that you'd be on a full liquid diet, which is anything in liquid form, plus pourable things like yogurt and pudding, and then a regular diet, but depending, you might have to have modifications to that. But day 4 would be that. And then if there's no bowel resection, full liquids day 2 after surgery, and then a regular diet after day 3. But it just depends. There might be complications that end up delaying that. And supplement drinks are helpful for a lot of people after surgery. So you want increased protein after surgery because you need that for healing. And that's going to be for 4 to 6 weeks or so after surgery. So consuming a high protein food with every meal and snack is really good. So high protein foods are going to be your meats, your chicken, turkey, fish, beef, pork, all of those are good. Nuts and nut butters, eggs, legumes, including beans and lentils. Yogurt, and Greek yogurt is higher in protein than regular yogurt, and then milk and also cheese. There are good benefits of having good nutrition for after surgery. So you're going to heal quicker after surgery if you had good nutrition, less chance of complications after surgery, such as infections, decreased hospital length of stay, and decreased chance of hospital readmission. So nutrition is very important before surgery. And then I want to talk about some symptom management, because there's a lot of people that do have problems like abdominal fullness and bloating is very common before surgery and can happen after surgery as well. So if you have this, then I would make sure you're decreasing in gas-forming foods and beverages, so like carbonated beverages, avoiding gassy foods like broccoli, cabbage, beans, any other gassy foods that you know cause gas for you, because that can be very individualized. Some people have trouble with onions or fish or various things. So you just need to limit what you know is a problem. And then also you don't want to use straws and you don't want to talk while you're eating, because both of those things can cause you to suck more air in and add to that bloating. And small, frequent meals and snacks can be very helpful. So not eating a large, like breakfast, lunch, and supper, but breaking it up into like 6 times a day eating can be helpful to better tolerate more overall. And then nausea can happen. So if you are nauseated, follow these tips, like doing dry, starchy, bland foods, crackers, toast, dry cereals. Chicken noodle soup is pretty bland. Alternate your liquids from your solid foods. So try not to have both at once, can just help with digestion a little bit. Avoiding or diluting sugary drinks like juice and Gatorade, especially if it's on an empty stomach. So I would do like half water, half the sweetened drink. Doing, again, small frequent meals and snacks can be helpful. And avoiding pills on an empty stomach unless it's a medication that you know you need to take it on an empty stomach. Making sure you take nausea medications when you first notice nausea, or if you have chronic nausea, just to take it scheduled and not miss a dose. And rinsing your mouth or brushing your teeth prior to and after eating can be helpful. Sometimes just taking a bad taste out of your mouth can be helpful. And then sitting up in a chair or bed for 30 minutes to an hour after eating. And make sure you're staying hydrated. So drinking fluids often, every 15 to 20 minutes can be helpful. Clear liquids. And again, diluting them with water can be helpful, better tolerated. And also just high fiber, so like salads and high fat foods can also be hard on nausea. So not doing fried foods or foods with a lot of butter, cream, oils, that can also be helpful. And with diarrhea, again, the small frequent meals and snacks can be helpful, but there's a lot of different reasons for diarrhea, and just kind of condense some things on here, but it's good to be able to trigger what it is that's causing it, so you're not having to avoid everything on this list. But in general, at least to start with, consuming more liquids in between meals than along with your meals, so limiting to about a half a cup of fluids with your meals is better. Avoiding any sugar alcohols, and they would be things like xylitol, sorbitol, malitol. They're going to be more in sugar-free gums and candies than anything, but reading the ingredients is going to be good. And then avoiding high sorbitol fruits. There's the 4 Ps, the pears, peaches, pineapples, and prunes. Decreasing overall sugar intake can be helpful too. So sugary foods, sugary drinks, candies, ice cream, cakes, cookies, those things may be bringing on more diarrhea. And then limiting high fat foods, greasy, fried foods, foods with a lot of butter and cream may be helpful. But again, it does depend on your situation and what's causing it. So finding out a cause is definitely helpful. And then trying to eat more bananas, white rice, mashed potatoes is starchy, white things, and oatmeal too, crackers, white bread can be better tolerated. And lactose is a possibility. Lactose intolerance is a possibility. So you can get over-the-counter lactase, which is the enzyme that digests the lactose, which is the sugar that's in milk. Either get that or avoiding lactose as well. But it's as simple as just getting the enzyme and taking it with any milk or milk products. Thank you. That's all.
Okay, thank you so much, Monica. We really appreciate that information. We are scheduled to have a patient speaker, but I'm not sure what the status is with him. So I think we're going to go next to our navigation talk, which is from Rebecca Harmon. And Rebecca is an oncology nurse navigator. She's going to tell us about some of the resources available to patients at Wake Forest. So I'll turn it over to Rebecca.
Hello, my name is Rebecca Harmon. I am the oncology nurse navigator at Atrium Health Wake Forest Baptist. And one of the biggest questions we get from patients is, what is a nurse navigator? Ultimately, as a nurse navigator, we are here for the patients as a resource. So a nurse navigator is a registered nurse with oncology-specific knowledge who offers individualized care to patients throughout their cancer care journey. We help to guide patients through the healthcare system and overcome any barriers to you receiving the care you need. So some of the things that we help patients with is getting timely access to care and coordinating your appointments. So we always call patients prior to the appointment to make sure they don't have any questions, concerns, or need directions to our facility, just to calm any fears before coming. We also provide education on your specific disease process and help you through your treatment plan. So if you have questions regarding your treatment, such as surgery, preoperative questions, postoperative questions, those are things that we can help with. We also provide information regarding supportive services. So if you weren't eating well and needed to talk with a dietitian, or you had transportation concerns, if you needed psychological resources, we can refer you to our cancer support program. So we have a lot of resources here for our patients. We also help facilitate communication between the healthcare team and ultimately support you in making your personal medical decisions. We can also answer any questions you may have regarding your specialized plan of care. Some of the most common barriers to care that patients tell us about include transportation to appointments, social and cultural disparities. We have a lot of patients that travel from out of town, so the nurse navigator can assist with any lodging needs patients and their families may have. And then probably the biggest barrier that patients experience throughout this process is financial concerns. The nurse navigator can assist patients with a referral to a financial navigator to help patients navigate through the financial process of a new cancer diagnosis. This seems to be the most common concern for patients. They get a new cancer diagnosis and wonder, how am I going to pay for this? Is this going to affect my job and my family life? Our financial navigators are equipped to work with patients and their families to reduce stress-related issues regarding the cost of treatment. They also help patients understand their out-of-pocket expenses and what their health insurance plans cover. I encourage you to call your own insurance company and see what your out-of-pocket expenses are. Educate yourself to the best of your knowledge, and then our financial navigators will help you kind of work through and get all the information that you need. Our financial navigators also utilize copay assistance and patient assistant programs to help with any financial barriers that you might experience. So the biggest thing that I empower you to do is ask questions. Ask the nurse navigator questions, ask providers, dietitians. We all work as a team, and we're all ultimately here for you throughout this process. I also encourage you to connect with other patients who have had similar experiences. You can do that through Facebook-specific groups and local support groups. We also encourage you to find reliable organizations that provide up-to-date support and resources like the ACPMP, PMP PALS, cancer.net, and rarediseases.gov. We also want to make sure that your family and your friends are getting the support they need, because a new appendiceal cancer diagnosis does not only affect the patient, but it also affects the family and your caregivers that love you the most. So there are a few resources for caregivers, including the National Alliance for Caregivers and the Cancer Caregiving Support and the American Cancer Society. Ultimately, we want you to know that you are not alone throughout this process. We are here to support you, answer your questions, and be there with you throughout this journey. So please don't hesitate to reach out if you need anything. Thank you.
Thank you so much, Rebecca. That was great. Next, we're going to hear from Stephanie Thornton. She is a nurse practitioner with the Surgery Oncology Department at Wake Forest. And Stephanie is heavily involved with the care of appendix cancer and PMP patients during the perioperative, postoperative, and long-term surveillance phases of care. Stephanie is going to give us some insight into health maintenance and especially how we can keep safe during COVID. Thank you so much, Stephanie.
Hello. Hello, how are you doing today? My name is Stephanie. I am the nurse practitioner here in the clinical setting at Wake Forest Baptist Medical Center with taking care of our appendiceal patients. I am going to be providing with you a slide show to assist you with being able to see some basic health management, long-term follow-ups for our patients, and how we can best manage all of that. Okay. I've been with the Surgery Oncology Department for over 6 years. Prior experience as a surgical nurse for the last 10. And as I've just discussed earlier, I provide care to our patients in the clinical setting. And over those years, I have developed some standard recommendations for the most common questions and concerns of patients in the appendiceal cancer and patients who have been treated with cytoreductive surgery and HIPEC. Following a cytoreductive HIPEC, the body undergoes many changes. Those can be permanent and also depends greatly on the extent of what was removed during the cytoreductive surgery portion. What will be removed cannot be precisely determined prior to surgery. The basic functions of the organs that are most commonly involved in the cytoreductions are as follows. The small bowel, which is about 10 feet long, absorbs nutrients, digestion enzymes from the pancreas. The large bowel, which is about 5 feet long, is responsible for absorbing water, electrolytes, and forms and stores feces. The omentum, which is adipose tissue, it provides limited peritoneal support, but is not involved in digestion. The spleen helps to control the amount of blood in your body and destroys old and damaged blood cells. The gallbladder assists with the digestion of and producing fat, storing and, gallbladder assists with digestion by producing and storing and transporting bile, which is produced in the liver to help break up and digest fatty foods in the small intestines. The pancreas assists with digestion and management of our blood sugar. 85% of the pancreas role is to provide digestive enzymes. The HIPEC, which is the hyperthermic intraperitoneal chemotherapy, is the most commonly used kind of chemotherapy during the HIPEC is mitomycin C and oxaliplatin. It is instilled through cannulas in the abdomen, and it is kept at a constant circulating temperature of approximately 40 degrees Celsius or 105 degrees Fahrenheit. This is circulated for about 2 hours here at Atrium Health Wake Forest Baptist. Other centers may use shorter times. There are typically minimal chemotherapy side effects, though some are possible. Most of the chemotherapy used in a HIPEC is washed out at the end of the procedure. Within a few weeks, the chemotherapy in the HIPEC has been excreted from the body. In a single prospective randomized trial for appendiceal cancer has been performed, which found that mitomycin and oxaliplatin have the same efficacy, but oxaliplatin HIPEC has a slighter, better quality of life during the first few months. The management of a cytoreductive surgery issues are the most common concerns. Digestive changes and elimination pattern changes are the most common. After removal of the small bowel and or large bowel, more liquid and stools are expected. Imodium and fiber are the first approach to this control. We recommend to develop a schedule that will assist with giving the patient the most control. For more control as needed, there will be prescription drugs that can be utilized as well. Controlling bowel movements provides better absorption of nutrients, reduces the risk of dehydration and malnutrition, and overall greatly improves the quality of life. Some patients also find using probiotics helpful. If the gallbladder is removed, foods that are high in fat will be more difficult to digest. If there is a portion of the pancreas removed, digestive issues and issues with controlling blood sugar can occur. Pancreatic insufficiency may require enzyme replacement therapy. Blood sugar changes may be managed with your primary care provider. It is recommended to get an hemoglobin A1C test at least once a year. This blood test provides a record of how well your pancreas is able to control your blood sugar for the first 3 months. Other health and management issues for patients who have had their spleen removed. As I mentioned before, the spleen helps to get rid of old blood as cells as they break down, but it also helps to fight germs and infections. Living without a spleen is safe. The spleen's duties are taken over by the liver, the lymph nodes, and other organs. You were given vaccines at the time of surgery and at your post-operative visits to assist with fighting the most common disease, viruses such as streptococcal pneumonia, meningitis, and Haemophilus influenza type B. You should receive a yearly flu shot and follow up with your primary care provider to get boosters for MMR and DTaP, Hib, and IVP. These protect against measles, mumps, rubella, diphtheria, tetanus, pertussis, and polio. Booster doses are suggested about every 5 years after your spleen has been removed, and patients without a spleen are recommended to receive a COVID vaccine booster. Since 2020, we have been dealing with COVID. Per the CDC, dated on October 1st of 2021, the following recommendations are for vaccines and boosters. It is strongly encouraged that everyone be vaccinated. And if you ask me what the best vaccination is for you, it will be the one that you can get. If you are at least 6 months since completing your vaccines, which means that your vaccinations were completed prior to April 1st on 2021, you should receive a booster if you fall into these categories. 1, you are 65 years or older. You live in a long-term assisted care or a retirement community. You work in a high-risk setting, or you have a chronic underlying condition such as currently receiving systemic chemotherapy, have or have had a cancer diagnosis, have no spleen, have a chronic or long-term disease of the heart, lungs, kidney, or liver, if you are diabetic, or if you have a compromised immune system or are a transplant recipient. Other important health management is specifically tailored for women. For premenopausal women who have had their ovaries removed, you should always follow up with your gynecologist to discuss hormone replacement therapy. For most patients, hormone replacement therapy is safe. A DEXA scan is recommended about 5 years after your surgery if your ovaries have been removed. This provides information regarding the density of your bones. The younger you are at the time you lose your ovaries, the higher the risk you are at developing osteoporosis. Mammograms every year beginning at age 50 is recommended. Continue with pap smears based on the guidelines unless a hysterectomy has been performed, and discuss these further with your gynecologist. Long-term health management is a priority for our patients. Healthy weight management, regular exercise, high-quality nutrition, and a well-balanced diet along with proper hydration provide excellent health management. Avoiding tobacco products and excessive alcohol use. A colonoscopy every 5 years is recommended for all fit appendiceal cancer patients. Regular yearly checkups with your primary care provider remain important. Oncology follow-up should not be in lieu of your primary care provider visits, but as a supplement to them. Long-term health management also includes doing all of the things that make you happy. This provides for an improved mental health management and creates lasting memories. Most important is routine follow-up with scans and blood work with your surgical oncologist. This allows them to monitor you properly and provide the best recommendations as needed. Thank you for allowing me to speak today. More importantly, thank you for allowing me to be involved in your care here at Atrium Wake Forest Baptist. I hope the information I have provided today answers some of your questions and also gives a framework to help manage your overall health needs. Feel free to contact me should you have further questions.
Thank you so much, Stephanie. That was great information, a lot of information, and we'll probably have a couple of minutes at the end for some Q&A, so I hope you stick around because I know I have some questions after that. But first, we're going to hear the patient perspective. We're going to hear from Edwin Melvin, who is going to be sharing his patient experience, and he is a patient at Wake Forest. So let's hear from Edwin. Thank you.
Hi, my name is Melvin Evans, Jr. I was diagnosed in 2018 with PNP cancer. It's formerly a mechanic, and this came out of the blue, healthy until my diagnosis. It truly shocked me. I wasn't expecting it, took no medicine beforehand, don't take any medicine now. The diagnosis was definitely different. It's a rare cancer. It's something that will probably scare most people, but you can't be scared. You have to go into it with a positive attitude and knowing that, hey, God had people to find out that you had this disease and they have a treatment for it. My diagnosis was PNP cancer. I had a coughing spell and we found out that I had the cancer had infiltrated or metastasized and spread to all my organs inside my cavity. And I was quickly referred to Wake Forest Baptist. I chose to use Wake Forest Baptist Cancer Centers because of the specialists. They have the best specialists from as far as what I could tell within my area on the East Coast. So only 45-minute drive away from Greensboro. So I really enjoyed the team that really helped me through my surgery, from the nurses to CNAs, the physical therapists, the nutritionists. Everybody was on the same page. My primary oncologist was Dr. Edward Levine, one of the top-rated specialists in the world, from what I hear. Don't remember her name, but it was a couple of nurses and CNAs. They were the ones that were helping me after the surgery was over. And they really impacted me, being fairly kind, listening to my stories, just helping me through. Before we had the surgery performed, we did a lot of research to try to find out more about my diagnosis. Doing that immensely prepared me mentally for what the surgery was going to be and the recovery as well. I had up to 5 surgeries. First surgery was about 14 hours. No pain through the surgeries, didn't feel anything. The recovery is the main components to, that's tough. So, but had to have a what's called HIPEC surgery. Also had a ileostomy bag. Thank God it was reversible, and that was part of the other surgeries leading up to that. From the surgery was probably more difficult on my family than myself. The recovery, on the other hand, was all on me. They give you great drugs to fight the pain. They also make sure that you have, don't have to worry about a lot of movement, because you won't be able to move. Laughing, breathing, crying, a lot of things you do will be disrupted due to the cut made through your midsection. You're going to lose a lot of muscles at the time that you need them, that you would expect to. We don't appreciate them. And this is something that I think that you won't recognize when you wake up, that, breathing, laughing, trying to just talk, all uses those core muscles, as people say. That's something that was surprising to me. Trying to cough when you're taking the tubes and things out, you almost can't do it. It just hurts so bad, even with medication. And so you need to be prepared for that. But every day is going to get better. And again, hope and positivity is going to get you through. Know that if you're having a rough day, tomorrow's going to be better. That's the most important thing that you can have. Again, family, friends, people that care about you, that's going to see you, that want to see you, to call and care. My wife was instrumental, and I have kids. That was probably devastating for them to have to know that I was going to have such a major surgery and multiple surgeries. But now I'm able to move around and take care of them, and so I think mostly the bag, ileostomy bag, not being able to breathe, cough when you first come out of the surgery. Within 2 weeks, you'll be somewhat back to your normal self. You're still going to have a gash. You're still going to have, a cut, but it's worth it. The life I've lived in the last 3 years have been amazing, and I probably wouldn't have had that without the surgery. I would definitely recommend Wake Forest Baptist. It is a comprehensive center. They encompass everything from women's health to kids to specialties in cancer. The care I received here at Wake Forest Baptist was stellar, A++. My wife's a nurse. She knows good quality service and care. When she sees it, she felt comfortable leaving me here for, sometimes days when she had to get some rest, and it was amazing. I never felt in danger Always felt I was being monitored and cared for and taken care of. So many different things on site, from the doctors, the labs. They even have a Chick-fil-A here. That's awesome. Great for my family. The different restaurants, the food. It was all under one house. I didn't have to go anywhere else. And that made a big difference in my recovery, how quickly I recovered, and my family, my mother, all my friends that showed. It made it easier for them not to leave campus. Everything down to even the reduced room rate y'all have for others that stay, family members that stay. That really helped out, especially my mother. She could stay close, get a good night's sleep, and come back and help my wife. It was amazing that so many people were on the same team, that thought the same, that all had their own part of the process. And they took it serious. They came with positive attitudes. I would just love to definitely thank Dr. Levine, his team, but especially the nurses. The nurses and the phlebotomists, I appreciate them sticking with me. And just everybody that was involved was just very caring. It's a different type of engagement when you have people that you feel just won't give up on you, even when you sometimes don't want to give up on yourself. So that's amazing. That pulled me out of some dark areas, and I really appreciate that. If you have this diagnosis of PMP cancer, I pray that you have family, friends that will support you. That's very key. Then also be prepared, because they don't know they're going to have to give you an ileostomy or colostomy. Be prepared for that in your mind, because that was tough to wake up from surgery to have that. It was one of my key no's. My wife made the right decision, of course, but being prepared for that possibility. It didn't happen immediately. It happened 5 days later. So be prepared for the care that comes, the extra care that has come with having an ileostomy, having a disruption to your bowel movements. One of the things that you have to come into any cancer, I think, or any disease, is hope. You have to have a positive attitude to fight this cancer, because it really starts mentally. It's a physical fight as well, but the mental can overcome the physical. And being positive and helping others be positive, because you're going to be on the cancer wing. You're going to see others that are sometimes in a worse condition than you are. So if you can be positive, get to walking as soon as you can. These things are going to expose you to others, which is going to hopefully enlighten your day.
Thank you so much to Melvin Evans for sharing his story. I know so many of you, especially those of you who've been treated at Wake Forest, can probably relate to a lot of that, but definitely a lot of inspiring thoughts he shared there. So we have about 10 minutes left, and we're going to do a short Q&A with Stephanie and Monica on some quality of life, nutrition, and just post-operative issues. The chat is open, so please feel free to put any questions in the chat, and I'll do my best to field them as they come in over the next 10 minutes. But to get us started, I wanted to start by talking about coordination of care with Stephanie. You went through a ton of incredibly helpful information that patients need to know. And I know so many of our patients are traveling from sort of near and far. And so what are your thoughts on how to coordinate all of those things between local providers and the care that you guys provide there at Wake Forest? What kind of advice can you give to patients to sort of navigating how to balance what needs to be done at home and what needs to be done at Wake Forest?
Typically, we recommend that your primary care provider manage you as an individual. If you would have seen your primary care provider for something prior to being diagnosed or receiving any care here at Baptist, that's where you would follow up. The information that I provided today, which was sort of managing your health after your diagnosis, can still be managed by your primary care provider. And they are by far your greatest asset and have the most up-to-date guidelines. Take, for instance, COVID. Last year when it hit here in the hospital, we tried to continue to make sure that our patients had access to us as well as we could and to treat them, but their primary care providers were the ones that were receiving the most up-to-date recommendations and the best way to manage their patient populations, because they have an overall idea about what all their patients face.
Right. And then we get this question a lot. So the patients come, they have HIPEC, they're sort of recovered, and a lot of them say, what can I be doing? What else can I do? I know nutrition is a huge part of it, so hopefully Monica can weigh in, but they're sort of like, what are the best things I can be doing to keep myself healthy, to keep this from coming back? And could each of you sort of weigh in on sort of your sort of go-to advice for patients on that question?
Sure. So that is, there is an individualization with that, because with certain organs that might be removed, there could be some diet modifications that are needed, but as much as possible, following a balanced diet with variety, like I had mentioned in the pre-surgery, getting plenty of whole grains and proteins and fruits and vegetables. You get different nutrients from all the different varieties. So that is really the goal.
I sort of have a running statement that I tell most of my patients is, have you ever seen the movie Eat, Pray, Love? I have my own version of that, which is eat, drink, and walk. So that is our best recommendation for you. We here in the hospital will get you up, we will get you walking, we will get you moving within a very short period post-operative. And we would like to see you continue that. The transition from the inpatient setting to the home environment requires you to kind of step up your self-care. And that's one of the things that I want to remind our patients is that once you've gone into that, then it's just a continuous slow process moving forward. But walking it helps in so many ways, from making sure that you don't develop blood clots, that you keep your lungs healthy, that you encourage your bowels to function properly, that you utilize all of the energy that your body continues to make in the healing process. And it also helps you to sleep better. Walking and drinking and staying well hydrated with that high quality nutrition that Monica focuses on so well, those are the things that are so important.
And then a couple of questions coming in the chat. One question came in. So after the first consultation, how long can a patient usually expect to wait until having surgery?
That does depend on whether or not there's chemotherapy involved, when their last chemotherapy infusion was, what type of surgery we would recommend, and also, in all honesty, what the schedule is available. For the most part, we have been minimally affected by the COVID requirements to reduce surgeries. We can, in some cases, have to postpone or move surgeries around, but we would always recommend that anybody who has an opportunity to get vaccinated prior to their surgeries, which means that they would receive their last vaccination at least 2 weeks prior to surgery, that is going to be a very beneficial thing for them also. So there's some factors that go into place before we could make an overall definitive answer to that question.
And that's a perfect segue to the next question, which is about boosters. The particular question is about the J&J vaccine, and I know you touched on boosters a little bit in your presentation, but if you could just maybe for all three of the scenarios, what patients should be thinking of in terms of boosters.
That's not a problem. So at this point in time, both the FDA, the CDC recommend the following. number one, vaccination for everybody. Only the Pfizer vaccine has a booster available and has been approved. That should be initiated 6 months after the completion of your entire of your last Pfizer vaccine. Booster for J&J and Moderna have not been approved, and they do not recommend that you mix vaccines at this point in time. So if you had a J&J, you need to wait until Johnson & Johnson has approval for a booster. If you had Moderna, then you need to wait until Moderna has approval for their boosters. But right now, Pfizer is the only vaccine that is approved for a booster.
For J&J patients, which is this particular one, we just sort of have to wait and see what comes out.
Right. For this particular one, it is, there's no booster available, and they do not recommend mixing vaccines.
Got it. So we have about 3 minutes left, and no more questions in the chat just now. So my last question for you, and it's a big topic for 3 minutes, but I think hopefully the two of you can weigh in a little bit. One issue that our patients have post HIPEC is just sort of these continual digestive issues. And I feel like sometimes a lot of patients are not really sure where to go to get help for that. And I know you guys have so many resources, and I wonder if you could sort of maybe go over again where patients should go for assistance on getting guidance on how to manage these issues. I just feel like so many of our patients have those issues and sometimes seem like they're not getting the help they need. And you guys have so many resources. So what do you advise for those patients?
So I would advise, so inpatient-wise, if I would make sure to educate on any specific diet that's needed based off of the surgery. And then if there's ongoing issues, I think being referred to an outpatient dietitian. We have a couple in the cancer center. I think that's a really good, helpful for patients with ongoing issues.
The other thing that really affects digestion is elimination patterns. Most of our patients, I can explain to you in the initial process or your initial consultation that this is going to be a difficult recovery, that this is one of the most invasive procedures or surgeries that's done, but it's sometimes really hard based on our life experiences to fully grasp what that means. And so this is completely a 6-week recovery, 3 months to your new normal. And during that entire recovery process, our patients have access to our triage team, to me, and to Dr. Levine, Dr. Shin, and Dr. Spoutnopoulos. We all work together to kind of manage you in that initial post-operative phase. We find that scheduled management of elimination patterns works best to kind of provide the patient with the most control. And what I mean by that is there are over-the-counter products such as Imodium and fiber pills, and there is also Lamodal, which is a prescription, and all of those can be taken in some form throughout the day together, individually, and on a scheduled basis. And we can slowly manipulate how those are taken or how frequently they are taken in order to provide the patient with more control. Then once we get the control, we can slowly start backing off, and we can see where the patient lies and what their long-term needs are going to be.
Yeah, I think a lot of patients think that once they go home, they don't want to bother their surgical oncology team with these issues. And I think what we're learning here is that please bother them. They are ready to help you. They have answers for you, and you need to reach out to them and tell them what's going on because they can help you.
Well, that's absolutely. Elimination patterns can run the gamut of both ways, from not being able to go to not being able to stop going. And we have protocols set in place already. Our triage team knows what to look out for, what kind of questions to ask to provide their provider team with the best information. And we just have an amazing group of people here that work and are dedicated to making sure that our patient population is well taken care of. And we have it all kind of laid out, and we can follow basically a protocol. It's almost like an algorithm. If you have this, let's try that. If you have this, we'll try this piece of it. So we do try very, very hard to look at what the patient is experiencing.
And a food diary is helpful. You're writing down everything that you consume throughout the day, and then when you have symptoms, to be able to see if there's a trend and a problem food. But yeah, and then also there are specific diets that relate to different things, like a stomach resection there's certain things to do with that, or if you have pancreas resection and then need pancreatic enzymes, that can also help with diarrhea. So there's multiple ways to go about it. But yeah.
Yes.
Well, we're just about out of time. So I wanted to thank you both for taking this time to do the Q&A. And I know there's a question we didn't get to, so please reach out to the Wake Forest team or to us at ACPMP. We're at info@acpmp.org, and we'll try and get answers for you. But thank you to all of our speakers at Wake Forest. Thank you to all of our attendees. We're so happy you could join us, and we hope that you enjoyed everything that we presented today. And take care. Hopefully we'll see you all next time. Bye-bye.
Bye. Thank you.